Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon and Gynecologist working at Vriksh Fertility, HSR Layout and Whitefield. Normally, pregnancy begins with a fertilized egg. In general, most often what happens is this fertilized egg travels to the uterus and gets implanted into the uterus and grows into a healthy, beautiful baby. But sometimes this fertilized egg fails to travel back into the uterus and it gets stuck on its way or implants anywhere else other than the uterus. This is called as the ectopic pregnancy. In ectopic pregnancy, the most common site of implantation is the tubes. In the fallopian tubes, if the pregnancy sits and grows, then we call it as the tubal ectopic pregnancy. This can be dangerous and life-threatening. Why? Because only the uterus has the capacity to grow and expand as the baby grows. So today, let's discuss about this. What are the early warning signs for us to identify this dangerous condition of ectopic pregnancy? Often, the first and the early warning sign of ectopic pregnancy are missed periods associated with pain, mild or severe pelvic pain or lower back pain. Third, it can be associated with minimal reddish pervaginal bleeding or spotting. Very rarely, it is also seen that some women may experience shoulder pain or may have little bit of bowel changes. These could or could not indicate a ruptured ectopic pregnancy. But the dangerous sign should be when you're feeling giddy, you have missed your periods and you're not able to see the pregnancy normally like how it should in your uterus. Then the suspicion of ectopic pregnancy rises. So your doctor normally may advise you to do an ultrasonography along with serial blood test monitoring of a blood test called as the beta-HCG hormone test. If this beta-HCG is slowly rising, then the suspicion of ectopic rises. If it is a healthy intrauterine pregnancy, then the beta-HCG value doubles up every 48 hours. Now, what are some of your emergency signs and symptoms? It is when the ectopic pregnancy ruptures and you have internal bleeding. This can cause in a patient severe pain abdomen, sometimes lightheadedness, giddiness, and may also have episodes of fainting and blackouts. Now, can you have a healthy pregnancy if you've had previously 2 ectopic pregnancies? Definitely yes. The chances of a repeat ectopic pregnancy is definitely higher, but it doesn't mean that you will not be able to carry a healthy uterus pregnancy in the future. Meet a fertility specialist who is going to evaluate your tubes, who is going to assess the tube situation, why this repeated ectopic pregnancy is happening. Either there could be a problem in the embryo or there could be a problem in the tubes. Or if it is ectopic pregnancy elsewhere, then they are going to evaluate and rule out other causes like abdominal infections, especially tuberculosis, etc. Fourth, and the most common cause is abnormalities in the shape of the uterus, which could be congenital. Example, it could be a septate uterus or it could be a biconjugate or uniconjugate uterus. In such cases, usually the implantation doesn't happen in the uterus and may go and get implanted in the tubes itself. So can we do anything about it? Yes. First, identify the cause. Second, certain advanced ART treatments like IVF may be recommended in cases where the embryo is directly placed into the uterus after ruling out all the other possibilities. Second, healing time. Once you've had ectopic pregnancy, allow your body to give enough time to heal from the previous ectopic pregnancies. This usually may range from any time between 3 to 6 months depending on the cause. Be kind to yourself and seek medical attention immediately.